Hi everyone, welcome to the 5-minute video studies for the NCE. And today we are going to be on areas of clinical focus, and we are behavioral problems. Now, this is a very general term. Usually, behavior problems are used. Usually in infancy with children. It's important to remember that behavior issues in children, well, as well as adults, are complex. So, what you see or what the family or the school or wherever the setting is the behavior. But there are a lot of things that people do not see. So remember the word multifactorial, which means there are multiple things which are um, tying into the behavior, as well as they're manifesting themselves in a variety of ways. So, some of the things that whenever people talk about behavioral problems, some of the things that they may describe could include social withdrawal, so not having appropriate relationships, or not having appropriate social um, social gatherings, or not wanting to participate in social events or groups. Aggression, that's a big thing when describing behavior problems. So hurting others, hurting self, hurting animals, hurting things. Those are all different types of behaviors that could be describing aggressive, behavioral issues. Depression, withdrawing, feeling sad, not wanting to do normal activities, um, not wanting to engage with peers or others, anxiety, excessive worry, um, you know, um, fear, excessive fear, really, hesitation of partaking in normal activities. Um, Another thing that could describe behavior issues are many times their poor academic performance. So the student was making adequate grades, and then one year those grades dropped significantly. So many of these behavior problems are first seen in the school setting, and then many times they get referred from the school to whether it's a school counselor or an agency that works with those types of overt behaviors. The parent, they may describe behavior problems as a form of acting out. So you may see how intergenerational conflict is really evident with behavioral problems, or could be family issues. Some children engage in overt behaviors because they're not able to regulate their emotions appropriately, or even have a channel where they can express themselves appropriately, or they may not even know how to express themselves appropriately. They may see what is in their environment, and they may think that that is a normal path of expressing their emotions, and their how they're supposed to behave. So just some of the things that as a counselor you want to keep in mind are developmental disorders, behavior disorders, ADHD or attention deficit hyperactivity disorders. the autism spectrum disorders, and as well as anxiety and depression.